Well, I was asked actually by Stephanie Graham at the community college to help develop a curriculum for a non-medical home health caregiver training course. And I developed that curriculum with the assistance of a few other people, but pretty much in its entirety, and am now teaching parts of the program itself. Our first class was small, but it was very positive. Several things. A lot of times when you teach classes, the students are sometimes ready to dart out the door at the end of the hour or class day, and these students were just the opposite. They stayed, they lingered, they asked questions and questions, and mostly how they could apply this to what they were trying to do, and many of them have different goals. One student already was employed in a nursing home, so she was using these concepts in her current job. A couple other students were seeking employment in the home health care field, and so they were going to try to be seeking employment because they were currently unemployed. And another lady was there for her own self-improvement because she was going to be taking care of someone in the home in a non-medical capacity who I think had some kind of dementia. For the students, they're a little bit older, and it gives them a chance to go a new direction or to expand on what they are already doing in their lives. So it's kind of a, like my background, reinventing themselves. Well, I initially started in nursing as a young person, and I did that for a while, and then I taught nursing, which forced me to get my master's degree. And wanting a little bit more control of my destiny, and I tend to be a little bit of a restless person intellectually, I guess, I saw a need at the hospital for an attorney and going into risk management. So I went to law school, and although I couldn't reach that goal because those jobs were hard to find, I did practice medically legal related fields and expanded my background in the legal field. And then recently I decided, after some personal experience with friends and neighbors particularly who had difficulty in the healthcare setting, and seeing what our healthcare system is going through right now, people need advocates. And on the East and West Coast, when you go to the doctor, you have an advocate with you, a lot of people, and especially elderly people. So I have started a new company to actually be a patient advocate and a nurse case manager that incorporates both my nursing and my legal background for people when they're navigating the healthcare system. Well, sometimes it's hard to take a leap from what you're currently doing and to think, oh wow, well, is this going to do me any good? But education's never a waste, and you might learn the littlest things that might improve your current situation or help you take the next leap into something you really want to do or you're passionate about but have been afraid to. And I think that's what education helps us to do. And so it's a pleasure for me to teach because I'm always not sure whether the students learn more or I do. So for me, it's been really inspiring, and it motivates me, and I think the 50+ program really caters to those students to help them get out there and stay still involved in the world and what's needed.